Dr. Rob Van Bergen. Welcome back to another Monday 10-minute training, our weekly training event where in under 10 minutes, I attempt to explain a concept in natural medicine and or the microcurrent world. Today, it's going to be a bit of a brief one, but it's an important one. I want to talk about the ins and outs of applying pressure when using microcurrent. Now, there are multiple reasons that one might want to apply pressure when using microcurrent. If you've ever enjoyed a massage before, you'll understand the relief that pressure can provide. Pressure during massage releases the tension built up in the muscles, tendons, and ligaments. And this often will relieve nerve compression as well, reducing pain and kind of all kinds. Now, massage can help also to remove waste and absorb fluids. It can reduce swelling associated with injury and discomfort. There are a variety of different reasons that it is beneficial. Now, is just applying a little bit of pressure with microcurrent going to be equivalent to a massage? No. But we automatically know that by applying pressure with, say, the Y electrode, we can get the effect enhanced by empowering the typical microcurrent treatment with the benefits of a gentle massage. Now, we know, and we've known for a long time, that microcurrent applied with pressure is more beneficial, even as we analyze the difference between passive and active treatment and the speed of the associated healing process. You see, we see that passive treatment, which involves no movement of the device over the body and is typically done with like sticky pads, conductive pads or something like that, does not remove active zones at the same rate that active treatment can. In fact, 30 minutes of passive treatment is considered less effective than 5 minutes of active treatment in providing the health benefits to the body. How does this kind of stack up? It depends on the protocol, right? Mitochondrial recharge is a passive treatment. You can't do that with the Y electrode because you're trying to treat multiple areas at once. So there are some benefits to certain passive treatments that are done, but the active treatments themselves, moving over the area, do have a more powerful and potent therapeutic effect. Now, the simple process of moving the electrode, even with minimal to no pressure, releases the pent-up tension and pressure and reduces the pain and inflammation faster because it gets rid of those active zones. Now, this process is enhanced further by additional applied pressure as well. So is there such a thing as too much pressure? Sure, right? It's possible. There's too much of anything. Even a good thing can be a bad thing. But that's going to be dependent on the individual. And really the only side effect to too much pressure is going to be a bit of a sore area, sort of like getting a deep tissue massage or after exercising, like lifting weights, how your arms can sometimes feel tired. That's sort of the minimal side effects that you might see. But with the idea of increased pressure in mind, let's look at things that can really benefit from that increased pressure, some of which you might not even think. So I've got my device here and I've got a Y probe. And the first thing I'm going to talk about is vagus nerve stimulation. Before we go any further, though, I don't want you to apply massive pressure to the vagus nerve. You shouldn't take the probe and press really hard on the vagus nerve. That's not what this is about here. Instead, watch the mild additional pressure as I demo the treatment and what it allows me to achieve. So we're going to turn the device on and we're going to set it to 7 to 12 hertz. In this case, it's already on that. We're going to hold the plus button down. Okay, and when I can feel that tingle, then I'm ready to go. So what I'm going to do is I'm going to feel for my carotid artery, right? So I'm feeling for the pulse in my neck, and I'm going to place the electrode behind that pulse. Now, here is where I apply the pressure. So what I'm going to do is I'm going to put gentle pressure, and then I'm going to pull forward. Now, just by doing this, it increases the sensation as I've made sure to trap that nerve so that I'm actually able to get that sensation. This is where a lot of people go wrong in not being able to get and obtain the jiggling in the neck that they're looking for because they're not applying enough pressure. So it's gentle pressure behind and then pull forward. and then you can complete treatment that way. You just want to make sure you control that jiggle. Another one that can be a bit difficult to pull off is little wings. This can be tough because a lot of people can struggle to get the current where it needs to be. This is especially true of anyone with a lot of scar tissue or tight muscles, all in that neck. So it's about using the right amount of pressure to bypass some of that pent-up tightness. So with this protocol, I tend to push fairly deeply. So you generally set your device to 121 hertz. You place the Y probe behind the ear like so, and then you drag it down to the neck, straight down in a line. Now, what you're going to do is you might need to move this back a little bit along your neck to find the right spot where you're feeling that tugging. And what I want to do here is I want to apply considerable pressure. When I apply more pressure, I'm allowing it to push deeper. There's nothing here that I'm really going to impinge upon, but I am going to get those lifts that I need. So it's all about that. Now, if I take off the pressure, let's see if I can, once I drop here, see if I don't put the pressure on. See, it's not moving, but then I increase the pressure and it will jump up higher. So the benefits of the pressure here can be very, very useful. And I have to finish little wings now because you never want to leave it half done. You got to do the same amount of pulses on the other side. And that's the best way to make sure it's done. If you do 2 pulses on one side, do 2 on the other, right? You just want to kind of get there. But the more pressure I apply, the deeper the current is able to go. It's able to bypass and get to the nerves and get to the muscles so that it can pull on them properly, right? So that's the goal here. Okay. Now, lastly, and obviously these are not the only examples, but probably the most obvious is the painting of active zones. This is doable with any tool that permits painting, the act of moving the electrode over the body. And this is definitely enhanced with deep pressure. Now, if I were to take my device, set it to 350, place it on my wrist here, and I would have just simply glided over the skin, it's not going to get that treatment done in the same way. It will still find active zones, but this is just me gliding here really gently with no pressure. Now, I've only done this on the most sensitive of individuals. Normally, what I do is I put pressure in that you can see the difference as it kind of sinks in, right? This is gentle, no pressure, and that would be considerable pressure. It allows me to work the tissue more deeply. And you can see I'm using this finger here to put that pressure on. So this is a gentle glide. This is a deep pressure. Now I can get way deeper through doing that. Now there are other tools that work really well for it. So the massage tool, I don't have mine here in the office today, but the massager tool, which is the handheld one, is really good for increasing that pressure as well. But really, any electrode that you're using gliding over the skin gently isn't going to get it done the same way as applying that additional pressure when you're trying to work out those sticky spots. So combining the power of gentle massage with the power of microcurrent frequencies can really enhance the healing experience. So that's just a few ideas on how we can utilize pressure to greater effect. So my questions for you: do you like applying pressure with microcurrent? Have you tried it? Do you hate it? What were the results you've gotten and differed? And if you haven't tried it yet, I encourage you to give it a try. And of course, do you have any questions for me about applying pressure? All you need to do is ask in the comments below, and I will get back to you. That is it for today's training. So take care, everyone. Have a great week. And I will see you next week for another Monday 10-minute training.